Hello everyone, I'll be talking about first aid for burns. I'll be mainly focusing on three types of burn: thermal, chemical, and electrical. So start off with thermal burns. As you can see in the diagram, there are three zones in a thermal burn. The outermost region is the zone of hyperemia, which is red in color due to the good blood supply, and then there's a zone of ischemia, which has a mottled red appearance, and towards the center there's the area or the zone of coagulation, which has no blood circulation, and has necrotic regions. This is an example of a thermal injury. As you can see, there's a bull's eye shape to this injury, which means it goes from less of a degree to a more extreme degree towards the center of the injury. So on the outermost region, you can see a first degree burn, which is red and painful, and towards the middle, there's blistering, which indicates second degree burn. And at the center, there's a dark charred area, which is dry. It indicates a third degree burn. There are four main steps of first aid. The very first step is to stop the burning immediately. So the patient should be removed from the burning agent, and also the burned clothes should be removed. And if the clothing is stuck to the skin, you should try to cut or tear around it. And if the patient has any jewelry, it should be removed, because the patient will start swelling up. Then it will be harder to remove those jewelry. And then the second step, as shown in this diagram, is to cool the burn. And this should only be done if the area of the burn is less than 25% of the total body area. And this is done by running cool water over the surface of the burn for 5 to 10 minutes. This will stop the burning process. And if there are any blisters on the wound, they shouldn't be broken. The next step is to apply dry sterile dressing. As shown in the diagram, you should start above the burn where the burn starts, and then lightly apply the bandage over the wound. And then finally, you have to check for signs of inhalational burns or signs of shock. Signs of inhalational burns are wheezing, swelling, and presence of burn marks on facial hair, eyebrows, nose hair. And also, you can check for soot in the mouth. If the patient shows any signs of inhalational burns, you should treat with 100% oxygen. And also, we have to establish the airway by placing an endotracheal tube. If the patient shows any signs of shock, then we should ask the patient to sit down or lie down, and the feet should be elevated to prevent shock. So, moving on to chemical burns, if the burn is caused by a dry chemical, we should try to brush off the dry chemical, and then we should start rinsing immediately. And this process will take anywhere from 15 minutes to several hours. The main purpose of main purpose of rinsing is to dilute the chemical, so that the effect of the chemical decreases. And then we have to apply gauze, and depending on the severity of the injury, we should seek medical attention. And finally, electrical burns. uh, there are four main points that we have to consider. First of all, we have to check whether we are in danger, and we have to check for the energy source, and it should be removed from the patient, or it should be taken away from the patient. For example, we can do it by cutting the power supply, or if the patient is holding on to a wire, we can try to remove it using a wooden stick. And both of these and electrical burns usually have two types of wounds: the at the entry point and at the exit point. At the entry point, the wound is small, and it can also have first degree, second degree, third degree burns. And the exit wound, as shown in this diagram, will have explosive damage. So depending on the consciousness of the patient, if the patient is conscious, we can rinse off the wound depending on the wound and apply gauze, and then we should take the patient to the hospital immediately. If the patient is unconscious and not breathing, we have to check for ABCs, which means airway, breathing, and circulation, and start CPR immediately. And the patient should be taken to the hospital immediately. Possible outcomes of electrical burns are bone fractures and arrhythmias, and most often patients die from arrhythmias caused due to electrical burns, and not directly due to the electrical burn. That's it about first aid for burns.